Good morning. Today I'm going to be talking about something that kind of is always in the back of my mind because of some personal experience that I've had with this issue. But I saw it on a talk show the other day, and it's called doctor shaming. How many of you out there are afraid to go to the doctor, not because of what he might find out is wrong with you, he or she, but because he or she may talk down to you, might lecture you about your lifestyle, about your weight, about the fact that you're still smoking cigarettes, legal cigarettes, or that you're even using birth control, which I have personal experience with, by the way. Doctor shaming. It's a problem, and it is a shame because every commercial you see, everything you hear in the news is how important having a good relationship with your doctor is. That you should get regular checkups. That you should feel comfortable when you go for a checkup. Yet how many of you don't? I hope you'll comment and let me know because there's a lot of you out there, and that's why I said this is a show for my viewers. On the talk show, a doctor was there, and she made the comment that it's so funny that when a male patient comes into her office, he just gets on the scale. But when a female patient comes to her office, she'll take her earrings off, her shoes, her socks, basically strip down to her undies to get on that scale. How many of you do that? I do. I always try to, especially being a victim that I've been very honest about, of eating disorders for most of my life. Since I was 14 years old, I've been a victim of eating disorders. Getting on a scale that is guaranteed to say that I am 5 to 7 pounds heavier than my scale at home tells me I am, for me, that is horrific. That is a reason enough not to go to the doctor. Because the scale is always wrong. And I can prove it's wrong, by the way. It is wrong. And it's not just because you're wearing clothes. It's because the scale is off. I don't know. I have 2 scales in my house. One that goes to the bay with me that is a digital battery-operated scale. And one that is old school. You just step on it and it spins around. Both of my scales in this house tell me that I weigh 104 pounds. That's 2 scales. When I go to a doctor's office and step on their scale, even if I get down to my tighty-whities, I mean, I wear sports bra, so I can take off all my layers, all my clothes, my earrings, I don't wear rings, I take my shoes, my socks, I am guaranteed to be 110 to 112 pounds. Now, I have learned to accept that. It's fine. Here's what I really love, though. The last time I went to my OBGYN, the scale was actually in the examination room. Now, you know what that means. I mean, you're already going to get naked for them. I just stripped completely naked and got on that scale. The door was closed. I said, you know what? You're a girl, I'm a girl. My doctor's already seen everything he needs to see. I stripped all my clothes off, got on the scale, and guess what? Miraculously enough, their scale was exactly the same as my scale. And I clocked in at 104 pounds. Yay, me! But how many of you think about that? On the talk show, they actually said that there are mostly women who won't go to the doctor until they lose 5 pounds because they know that the doctor's scale is going to be 5 or 6 pounds heavier. And they want to impress the doctor. And my question is, why? This is your doctor. Why do you care what you weigh in front of him or her? Why do you care? Doctor shaming is the #1 reason why people don't go to the doctor. And here's what I'm going to tell all of my viewers right now. If you are going to a doctor on a regular basis who makes you feel less than, who is talking down to you, who is criticizing the decisions you're making in your own lifestyle, get a new doctor. He's fired. I have said this many times on this show, and it sounds like I'm bashing Planned Parenthood, and I kind of am, and I'm kind of not. Planned Parenthood is a necessity in our country because our country is the only country in the free world that does not, as a government, provide national health care for our citizens. So we need clinics like Planned Parenthood. When my husband and I were starting out and we were poor, we needed Planned Parenthood in order to stay child-free. I needed my birth control, and I needed to get it at an affordable price. So I went to Planned Parenthood. And what I got there was a girl, not a medical doctor, a physician's assistant or a nurse practitioner, doing my pap smears every year and giving me a lecture, talking down to me. This girl was younger than me, and yet she was telling me, you shouldn't be on no birth control at your age. Your husband should get a vasectomy. You need to quit smoking, and you need an osteoporosis test because you're going to get osteoporosis because you've been on this birth control so long. Every year for 6 years, I had to listen to this bitch act like she knew better for me than I did. First and foremost, little girl, I'm not one of your 16-year-old patients who comes in here with syphilis and all these STDs and is sleeping around. I am a married woman. I am 40 years old. You don't talk to me like I'm one of your little girls. You talk to me like an equal, like a peer. And actually, you respect me because I'm older than you. And this ain't my first rodeo. I have had pap smears every single year since I'm 20 years old. You don't lecture me about birth control. You don't want me to use birth control, tie my tubes. Oh no, I can't do that. Just let your husband get a vasectomy. Well, guess what, little girl? Not every man out there wants to trust his family jewels to a surgeon. And my family in particular, me in particular, who has been a victim of malpractice multiple times in my life, is not going to put my husband at risk for losing his virility for the rest of his life, which can happen with a vasectomy that goes wrong. And because me and my family have had so many things go wrong with medical doctors and normal minor surgeries, my husband isn't just going to walk into a room and tell a doctor to cut his balls off. My husband doesn't want a vasectomy. Birth control, as far as I know, is legal, and I like my birth control, so you will continue to give it to me. And I should not have to defend myself to you, little girl who's not even a doctor, but is licensed to give pap smears to women. I don't even really want a pap smear. The only reason I'm here is because you tell me if I don't let you do a pap smear on me every year, you won't give me my birth control anymore, which I also believe should be illegal. A woman should not have to submit to any kind of invasive preventative test for anything in order to be child-free. Birth control should not come with that price. And believe me, that did come with a price for me when the Planned Parenthood lab made a very serious mistake that cost me $1,500 out of my pocket because my pap smear came back abnormal. And of course, they stood by their lab and got me all thinking I had cancer when actually their lab did an oops. $1,500 out of my pocket. Now, I did get $200 of it back when I threatened to sue them. But it took a year of my life to prove that they made a lab error. Because they treated me like I was 5 years old. Now, Mrs. Luciano, you know you have the HPV. Yeah, your husband probably gave it to you. It happens. Don't blame him. No, you know what? You never tested me for HPV, so how can you tell me I have HPV? So I had to get up in their face. I wouldn't let them talk down to me. And when I was going through all of this with the cervical mistake, the pap smear mistake, I thought about my mother, who was killed by malpractice, because she would never question a doctor. The doctors were God. If they said the sky was green and she thought it was blue, yeah, doctor, the sky's green. I see it. We have to question our doctors. My mother, if my mother had been in the same situation I was with that pap smear, she would have done every single thing those doctors and people at Planned Parenthood told her to do. She would have had, well, I did have the colposcopy, the biopsy, which I'm sorry I did, because it was something I didn't need to do, and it didn't show anything anyway, because there was nothing to see, because there was nothing wrong with me. But then when they said, oh, now you need cryosurgery based on the colposcopy results, which I found out later said there was nothing there, my mother would have done the cryosurgery. I said, no, I'm going to another doctor. And if I have to go to 3 other doctors, I will. I'm going to hold off. You're not going to control my life. How many of you go to the doctor and he says, oh, you haven't had a mammogram in a while. And all of a sudden you feel like you're this big. Just say, you know what? I'm working on it. Because it's none of his business why you haven't had a mammogram. You don't owe your doctor an explanation for your lifestyle. I know that I get a mammogram whenever I feel like it. I get the urge, oh, maybe I should get a mammogram. It's been a while. And one time I went to this place called the Imaging Center here in Lancaster. And I got this huge lecture. It had been 4 years since my last mammogram. And you know what? The mammogram people fucked me over too. My very first mammogram when I was 40 years old came back, area of concern on left breast. Come in for another mammogram ASAP. And they wrote with a Sharpie all over my breast and made me feel like I had been raped. And you know what? Nothing was wrong with me. There was like a fly on the x-ray machine or something or the guy who was watching my image saw something and lost his mind. But I had to pay for that second mammogram. I had the Sharpie black shit all over my left breast. I came home, I sat in the bathtub, and I took a toothbrush and scrubbed as hard as I could till I was raw. I felt like I had been raped because there was nothing damn wrong with me. And I didn't need to go through that. So yeah, it took me a while to want to go back for another mammogram. But I did. And when I called to make the appointment, here's what I said. It's been a while since I've had a mammogram. And when I come in for this appointment, I don't want the lecture. I'm coming in now. That's all we need to talk about. You don't lecture me. You don't talk down to me. Because this is my body. And I don't need to have any one of you who has never walked a mile in my shoes, a foot in my shoes, an inch in my shoes, lecturing me that I've somehow been a bad girl because I waited 4 years to have a mammogram. None of your damn business. Shut up. And if you won't, I'll go find somebody who will treat me with the respect I deserve as a paying patient, a paying client, who will sit in your waiting room for an hour and a half, even though I have first appointment of the day, and get the test done. Remember something else about all these preventative tests that you're told you have to have. Labs lie. Labs make mistakes. And there are some things out there that just cannot be tested for. I know a beautiful young woman who one year celebrated Christmas with her family, healthy, happy, just started a new job. And then in February, she was diagnosed with stage 4 pancreatic cancer. Stage 4! December, she's celebrating Christmas. She's healthy. She feels great. Maybe a little tired. But aren't we all tired? Stage 4 pancreatic cancer. And by the following February, she was dead. No preventative tests, no lectures. Just dead. We go to the doctors to make ourselves feel better. And by just walking into a doctor's office, the first 5 minutes, if we're made to feel bad, we have the wrong doctor. And remember this too. A well visit where you get the results and everything's negative and, oh yay, I don't have cervical cancer, doesn't mean you don't have breast cancer. I go to the mammogram, oh yay, I don't have breast cancer. It doesn't mean you don't have pancreatic cancer. It doesn't mean you don't have bladder cancer or brain cancer. See, they don't preventive screen for that crap. And it's killing a lot of people. All these cancers there are no preventative screenings for kill people. You think when you go for your annual pap smear that you don't have any reproductive cancer. Wrong! It only screens for cervical cancer. It does not screen for ovarian uterine cancer because guess what? Yeah, the doctor shoves his hands up your vagina and feels around. But he's not going to feel the big stuff. Not going to feel it. Because, see, the little stuff you can't feel with your bare hands. That requires more testing, ultrasounds on your reproductive organs, which most of us can't afford. And our insurance won't cover it unless you have family history of ovarian cancer. Then you can get an ultrasound. Don't assume because a doctor tells you so that you're healthy. Don't assume that because, oh, I quit smoking, I'm never going to have a stroke or a heart attack or get lung cancer. 30% of all people who get lung cancer never smoked a day in their life and never even lived with a smoker. And just because you quit smoking doesn't mean you still don't have a pancreas and a bladder and a colon. And oh, aren't colonoscopies fun? Yeah, I love it when my gynecologist says to me, you know, have you had your colonoscopy yet? You are over 50. And I'm like, yeah, okay. When they stop having colonoscopies that require you to shit out everything you've ate for the last 2 years in one day for the prep, before you even have the 18-foot tube stuck up your ass, that's when I'll have a colonoscopy. Not before. No thanks. But see, my doctor's good about that. I have a great doctor, actually. Now, my OBGYN is awesome. He will let me know, yeah, you know, you're due for a mammogram. And then I'll be like, yep, I know, I'll take care of it. You know, you should cut back on smoking if you can. Yep, I'm working on it. And oh, by the way, you should probably schedule with a gastroenterologist and schedule that colonoscopy. No thanks. And you know, he just laughs. I have a good doctor. A doctor that has never shamed me. A doctor that I'm not afraid that if it's been 4 or 5 years since I've seen him, that I'm going to go in and get a lecture for actually doing the right thing and saying, well, it's been a while. Let's just check everything out. Make sure I'm still as good as I was 5 years ago. I feel good. I don't expect any problems, but let's get it checked out. There are a lot of reasons why people hold off or don't get regular exams. And it's not the doctor's business to even ask. It could be you lost your insurance. It could be you lost your job. You just don't have the money. But that's not their business. And it's not their business to shame you or to ever make you fear just even walking into their office because of the way you're going to be treated by them. And remember this, my viewers, my dear viewers. You are paying to be in that office. You are paying their salary. They work for you. You don't owe them anything, let alone an explanation for why you haven't been there for a while, why you've gained a few pounds, why you're still smoking legal cigarettes, or why you don't feel like having an 18-foot snake shoved up your ass. Political Paula, out.